So, friends, on behalf of My Retired Life Foundation, extend a very hearty welcome to this exciting program in store for us. All of us are old and getting older and older, and therefore we thought this is a very apt topic for us. That is the aging and the brain health. And to talk on this particular topic, we have with us a very eminent person from the city of the Bombay, Dr. N Prem. Dr. Prem is the founder of the geriatric department of the Jaslow Hospital. He is a geriatric surgeon with about a decade of experience and very actively involved in the teaching, research, and other areas of the geriatric medicine. He's a very known figure in the city of the Bombay in terms of the treating the older patients. He's very compassionate, very caring, a very nice person indeed. And he's very close to our My Retired Life Foundation also. We have also felicitated him in one of our first October functions to celebrate the elderly. So on behalf of all of you, we thank Dr. Prem once again for having come over here to spend some time with us. The floor is open to you, sir. Dr. Prem.
Yeah. Good evening, everybody, and thank you, Dr. Sengupta, for that kind introduction. It's always great to be back to present with my Retired Life Foundation. So, yeah, today is of course World Alzheimer's Day, and yes, but we are not going to be talking about Alzheimer's today. But yeah, we are going to talk about brain and aging and how obviously you can take care of your aging brain. So, how the aging brain actually affects thinking? So, the brain, as we know, controls many aspects of thinking. So, one, of course, is remembering, then it's planning, then organizing, making decisions, and much more. So, it's not that the brain is only important for remembering, it's actually important for a lot more. Even us, maybe, for example, having a conversation, making an expression, writing something with the pen, touching something, everything actually is a complex task, which is actually done, I mean, which we feel is done very simply because our brain is such a well wired organ. Now, these cognitive abilities obviously affect how well you can do your everyday tasks. So, even your everyday tasks and how independent you can live is directly proportional to how your brain obviously works. So, of course, as you age, there could be changes in thinking. Of course, it doesn't happen with everybody, but a lot of times, most people might maybe see that they are getting slower to find words, maybe recall names, have even problems with multitasking, and experience maybe sometimes mild degrees in the decrease in the ability to even pay attention. So, that is also something that can happen as you age. But I feel there are a lot of advantages as well. Aging also brings a lot of positive cognitive changes. So, what are they? See, older adults have larger volume of vocabulary and greater knowledge of the depth of meaning of words as compared to younger adults. Why? Because they have actually used much more words, much more conversations in their life as compared to maybe younger individuals. There's also belief that they might have obviously many years of accumulated knowledge and experiences. And these knowledge is something, yes, I'm sure that all of you are even trying to gain to this day because learning is a never ending process. And as you get older, there is nothing there. It's only a myth to say that you cannot continue to learn. So you should continue to learn even now. And as far as experiences are concerned, yes, on maybe every front, whether it's your work front, whether it's home front, whether it's personal, whether it's public, whether it's friends, family, colleagues, uh, good, bad. I mean, there are a lot of experiences that you might have had. A lot of them help in learning things, a lot of experience you want to forget, but it's accumulated over years. So, obviously, as you get older, the more experiences are there and the more accumulations there. And we obviously, as we get older, we tend to use those experiences even in decision making. But that doesn't mean that as you get older, you cannot learn things. You absolutely can. You learn new skills. You can definitely form new memories and even furthermore improve your vocabulary and language skills. And I've seen so many people actually taking up new languages, taking up new skills as they actually get older, not because they have more time or less time now, but because they want to keep themselves busy and want to make sure that there is a continuous challenge in life. See, the brain does change with age. It's not that it doesn't. Certain parts of the brain shrinks, including those important for learning and for maybe complex mental activities. Now, in certain areas of the brain or regions of the brain, communication between neurons, which is, of course, you can say the heartbeat of the brain, becomes less effective. Then, to an extent, blood flow in the brain might also decrease. So, that is something we have to be cognizant of. So, what is cognitive health or what is this brain health that we are even trying to discuss? Now, cognitive health is the ability to think, learn, and remember clearly. Now, think, learn, and remember, these three are very important to even carry out the everyday activities effectively, as I mentioned earlier. But the brain is not only about cognitive health. Cognitive health is only the one aspect that the brain covers or the brain is able to do. Factors that contribute to cognitive health. Genetic, environmental, and lifestyle factors may contribute to a decline in the thinking skills and also the ability to perform everyday tasks. So, see, we don't live alone. We live obviously in an environment. Our interaction with the environment matters. Our lifestyle, whether it has been a good one, bad one, it has been a healthy one, also matters as you're getting older because it will lead to whether there is a decline in the thinking skills or whether we have the inability to perform everyday tasks. So it matters. Now, what is brain health? Now, brain health refers to how well a person's brain functions across several areas. This actually is a beautiful slide in which the brain can be shown as a complex sort of collection of neurons and you can say connections and electrical circuit, but very beautiful to see with various parts of the brain being lit up. And that's how our brain actually is. Our brain has various parts with various functions, and it lightens up every time we're actually doing a lot of things. As I said, aspects of brain health also include things apart from cognitive health. So, cognitive health is something which I have mentioned, how well you think, learn, remember, but your motor function also. So, when you are trying to make or control movements, which includes even balance. So, if you're walking, balance, your gait, then there's a distinct emotional component as well. How well you are able to interpret, how well you respond to emotions, whether the emotions are pleasant or they're unpleasant. So they are obviously there are different situations in life and the way you respond. So the emotional function also matters. Then tactile function. So how well you feel or respond to sensations which are very off touch, which are everyday sensations, pressure, pain, temperature. And one of the very important things is the sensory function, which are the ones which we call as indriya also. Uh, Seeing, hearing, taste, detecting odor. I think all these four are very important. If you add another thing to it, that is the teeth, it actually builds the cornerstone of how good your quality of life is. If you are not able to see, if you are not able to hear, and if you don't have teeth, then these three can really affect your quality of life significantly because it directly or indirectly affects nutrition and it can also affect your brain. Now, how to take care of cognitive health? It's very important that the recommended health screenings, that is, yearly screenings, are done. One should take care of your health. You cannot take care of your health just by sitting at home. You will have to check up, have your health screenings, and it is good to have health screenings. We discovered that in the pandemic, a lot of times there was a lapse in the same, wherein maybe older adults did not get themselves examined with even with blood investigations. If they did not get COVID, their routine investigations and their routine checkups didn't happen. And yes, certain diseases did get a bit more worse. That brings me to the second point. If you have chronic health problems, whether it is high blood pressure, whether it is diabetes, depression, high cholesterol, please do take care of these. Managing chronic health problems is a cornerstone of actually taking care of your physical health, which indirectly will be very important for your cognitive health. Talk with your healthcare provider about the medicines that you take and the possible side effects they can actually have to your memory, for your brain function and sleep. So, a lot of medicines which are specifically taken, especially for sleep, of course, it depends on what is the dose, how many medications you are, whether there are certain medications with which these medications can interact and maybe lead to even further cognitive issues. So, these questions are something which you should definitely ask your healthcare provider. Then it's very important to understand hearing and vision loss, but it is very important to act on it also. A lot of times we do discover that we have age related hearing loss or we have age related vision loss, but a lot of times there is resistance, especially to get the hearing aid. Whereas most of us do end up getting spectacles, but not only to get spectacles, but to also monitor yearly the eyes. But even when numbers change, a lot of times, not every time, when the problem starts, older adults do go to the ophthalmologist. When it starts affecting their quality of life, that is when they start visiting. Then reduce the risks of falls and other accidents. Now, with every fall, if the person actually gets hit on the head, then that would be very bad news, because getting hit on the head indirectly will anatomically, as we say, if any part of the brain gets damaged, then the risk of obviously brain injuries and destroying of brain health automatically occurs. Then our vices, as far as the vices are concerned, limit the use of alcohol. Note that some medications taken with alcohol are quite dangerous. Quit smoking. A lot of older adults ask me that, is it too late to quit smoking? No, it isn't. Even if you have smoked for all your life, you can still quit smoking and have a better life, how much ever is left. Avoid nicotine products such as chewing tobacco. Then they always talk about whatever you eat matters. So be mindful of your diet, because that directly influences your physical health. Try to choose fruits which are nutritionally dense, not very high on animal fats, and high in vitamins and fiber. Again, not choosing, sometimes you might have to choose your diet depending upon availability or presence absence of teeth, because the consistency, if you have teeth, then solids become much easier. If you have lesser teeth, then maybe solid foods are difficult to eat. So sometimes you might have to modify according to the presence and absence of teeth. Sleep is very important. A lot of times, generally, it's a myth that older adults are even said that no, as you get older, you will tend to sleep lesser. Nothing of that sort. A lot of old people do get good sleep. Anything between 7 to 9 hours each night is ideal. But if you feel that you sleep at least 6 to 7 hours of good sleep rather than being 9 hours in the bed and not sleeping, I think 6 to 7 hours of good sleep would be preferred as compared to just sitting on the bed and not sleeping at all. So the quality of sleep matters, not necessarily always quantity. Then please manage your health. So how do you manage your health? By monitoring and controlling your blood pressure. If you have blood pressure, please treat the same. If you don't have blood pressure, please check the same. Because if you can check, if it's normal, well and good. Then control your diabetes. If you don't have sugars, it's good. Keep monitoring. If you do have sugars, please monitor regularly. see which medications you're taking. Do not stop or start medications on your own just because you feel that today the sugars are controlled. Then another very red flag thing is if your sugars are low. I am much worried as you get older that if the sugar falls below 100 and or you have hypoglycemia. Why? Because the brain needs glucose. The lesser your sugar goes, the worse it is for the brain. Then taking care of the weight matters. Reduce your weight, reduce obesity. Now, drastic weight loss, of course, in older adults is not preferred, but be careful with weight because a lot of times, if you are having overweight or obesity, then your sugars automatically go, even your cholesterol increases, even blood pressure increases, chances of heart attack and strokes increase. So, everything is interrelated. Then, if you're not able to walk, because of the weight, then the knees might get bad. If the might get bad, it might be because of the weight. But you want to shed weight to actually improve your knees. So then it becomes a vicious cycle wherein you are not able to do either and you might end up being immobilized. So always try to control your weight. I will not say drastic weight loss is ever good. Drastic muscle loss is also not very good in old people. But that doesn't mean that overweight is good. So one has to be very, very strict about that as well. Then eating healthy foods. Unfortunately, most foods that taste good are not healthy, but a healthy balanced diet can always be maintained, maybe with cheat days in between. Now, this consists of fruits and vegetables. So, if you see any healthy diet, whether it's in any country, any region of the world, if you have good amount of fruits and vegetables, it is always better. In fact, throughout the day, if you have multiple bowls of fruits, it is highly helpful. One is it is quite light, but at the same time, when it is full of fiber, it's good for the tummy also. Of course, you might have to restrict certain fruits depending upon whether you have sugar. Then whole grains. If you're a non-vegetarian, then lean meats, fish and poultry is good. Low fat or non-fat dairy products is important. Now, always limit solid fat, sugar, and salt. All the three are not good. So, the amount of sugar in your diet should be much lesser. Salt can be restricted. So, if you have blood pressure and if your doctor tells you no, you should restrict salt, do not take it to the extreme and stop salt because a lot of older adults stop salt completely and then their sodium falls and then they get what is known as hyponatremia, which actually is maybe even worse or maybe even more difficult to actually treat as compared to even hypertension. Then what is important is never the food that you're taking, it is the quantity that you take. So the portion size should be controlled. Then we keep harping about food, 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 but we forget about water and liquids. So it's very important that a good amount of liquids are taken, at least 1 to 1.5 liters per day. It could stretch to maybe two also. However, it might have to be restricted, especially if you have heart disease, maybe kidney disease or liver disease, which you would be told, oh no, you cannot take more than 800 ml or you cannot take more than 1 liter. A lot of times, taking only water can be boring. So you can take lime water, coconut water, you can take buttermilk charge. Try to make water also interesting. But as far as fruits are concerned, always raw fruits will be superior to actually juices. So the best way of taking the fruit is the fruit pulp itself, that is the fruit itself, and not the juice form. But lime water and lemon water can be taken because it's quite refreshing and it's quite a natural electrolyte. See, and no vitamin or supplement is recommended for preventing Alzheimer's or other forms of cognitive decline. However, if you have vitamin B12 deficiency, if you have folic acid deficiency, then you should correct it because these two are when these two deficiencies can take place, then there is obviously a higher risk of getting dementia. Then coming on to the fact that physical activity. Now, why should you do physical activity? Now, physical activity actually is very helpful. It improves your strength and it will also help in maintaining it. You will end up having more energy. Your there are types of exercise also. So there are strengthening exercises, there are aerobic exercises, there are resistance exercises, and there are balance exercises. So it will be very helpful in preventing or delaying heart disease, diabetes, and other disorders. So when you actually have good physical activity with a controlled diet, heart disease, history of stroke, diabetes, all these disorders can be delayed or even prevented. Physical activity, when done alone or maybe even with other people, even helps in improving your mood and reducing depression because it gives you a sense of fulfillment, and a lot of people enjoy doing the same. Then ideally it's recommended that all adults do at least 150 minutes, that is 2.5 hours of physical activity each week, which could roughly come to around maybe around 30 minutes per day, maybe not doing in the weekends or weekends you can do some more. If you can cross more than 150 minutes, so be it. That would be great. But always when you're starting, don't go full throttle. See how much time you can do first day and then gradually increase your pace because there are a lot of older adults who want to exercise and they tend to just go full throttle half an hour, 40 minutes day one, and then they don't walk again because they get too tired. So give yourself a chance, give your body a chance to build up to it. Walking is always a good start. A lot of times doing things on your own might be a problem, so you might need more motivation. So in that way join programs which help you to move more safely and help prevent falls. It's important that you do group therapy or even fall prevention. Why? Because as I told you, if you fall, then there could be a chance of serious injury, and this could be injuries to your brain, which is not good for you as you go ahead. Then keeping your mind engaged, I think that is very, very important. Keeping yourselves busy. Now, cognitive training, which is designed to improve the specific cognitive skills, appears to have benefits for maintaining cognitive health in a lot of older adults. Now, staying engaged in other meaningful activities as you grow older may have very important cognitive benefits. So, you have to keep your mind engaged, which is very, very important. Research has shown that music, theater, dance, and creative writing have shown promise for including quality of life and well being. Not only does it help in improving memory, but it also helps in improving self esteem. That I am able to do this or I enjoy doing this. And it reduces stress and increases social interaction. So, if you see all these, especially music, theater, and dance, a lot of them is doing in groups. And when you do things in group, there is more social interaction, and creative writing also could be done in a group. Now, learning a new skill always helps. Now, learning a new skill could be anything. It could be gardening. Research has shown that gardening is very important. It helps in actually development of the brain and even neuroplasticity. That is help in developing new connections. Why is it good? Because it's almost a sense of nurturing. You are actually growing a plant, you're going to water it every day. You are actually going to maybe even add manure, you're going to add more seeds, take more pots. So ultimately, you will be taking care of it long term and it will be something you'll do every day. And that is very good. It involves quite a bit of skill and thought. Then practicing music, practicing art, learning a new language, learning a new instrument, even as much as brushing from the other hand, not your dominant hand, or writing from the non dominant hand, actually creates new neural connections. So, for example, there is people or usually ask me what is so different in Japan where people actually live quite long. So, in a place like Japan, especially in a place known as Okinawa, where people, a lot of them are above 100. In fact, in families, it runs 80s, 90s, hundreds. So they have actually the secret there, of course, to keep even their brain healthy is they keep having social interaction. They eat small portions of food, and the activity that they have is not necessarily exercise or gym. They have always been doing gardening from a small from maybe when they were very small. So what happens is every day they have to bend down, bend up, bend down, bend up. So this they have been doing for years. So their lower muscle strength, balance, everything is maintained and not necessarily going to a gym. Then there is a place known as Sardinia in Italy. Even there is a huge population of older people. So the beauty about Sardinia is they live up top a hill and they have very good, very good brain function also. So you must be like, and it's in Italy. So Italy is all about pizzas, pastas, and uh, cheese. So how do you even think they will be healthy and living long? No, again, why? Because everything they eat is never processed. Everything they eat is freshly made. So even if they eat pizza, it is freshly made dough, which they utilize and then they don't reuse it. So they only make that much. Pasta is also freshly made. So nothing is actually processed. Then where do they burn calories? They live up a hill. All the shops are down the hill. So every day, even for their basic things, they have to walk up and down. And this they have been doing for years. So it is naturally coming to them. And at their age, also 70s, 80s, 90s, they are able to go up and down the hill. So what I'm trying to emphasize is to get good brain health to age successfully, there is no one mantra. You need to develop your own mantra and learn from others as to how we can expand aging well and aging our brain well. Then connections. I think life is all about connections. Now, for example, if the pandemic in March or maybe in Jan 2020, I am sure everybody of you must not even have thought that we will be meeting online because everybody was meeting in person. The company known as Zoom itself didn't know how much profit it would make forever. But Zoom is very common. Every older adult even knows about it now. Everybody is technologically enabled and you are staying connected even in person. So that's how it is staying connected. Ideally, offline and online both is good, but yeah, offline is great because you actually end up meeting people. So always stay connected with your family, with your friends, neighbors, whether it is just like that or through social activities, through community programs. It helps in warding off isolation and loneliness. Now, isolation and loneliness was not something which was never there. It was always there, but it actually sort of lifted its head to a great extent during the pandemic, where there are a lot of older adults realized that they could get isolated and lonely, and nobody even could come to them because of COVID, because they were the vulnerable population. So they were not allowed to go out. At the same time, not a lot of people were visiting. Then, to strengthen your social connections, try to do something about it. So, how do you do it? You can obviously consider volunteering, maybe for a local organization, or join a group focused on an activity. It could be a reading club, it could be a singing club, it could be a laughter club, it could be a walking club, it could be a club where you meet in one part of, maybe if you're in Navi Mumbai, so you choose Kharghar and you're going to explore all the markets there. So I'm just giving an example where people liking something and exploring. So there are a lot of walking clubs which are in Bombay, Delhi, especially in South Bombay side, where there are tours itself, wherein people have walking tours actually to see all the old buildings in Bombay, to see and understand what the legacy of these buildings were. Then there are night tours also, wherein they are known as the ghost walk tours, where there are stories of various instances which are there. But people do it together and it's fun trying to explore places. Then there are food eating tours as well, wherein people actually get together in their common love for eating food. So doing thing in a community, it is dual. It has a dual advantage. One is you're doing something that you like. Second is while you're doing something that you like, you are exploring more and more new social connections. You're meeting more and more people. And this is not necessary of the same age group. You might end up getting people who are much younger, and intergenerational bonding is only helpful. It's very important that throughout this time, if you have physical and mental problems, you have to address them, whether it's diabetes, whether it's hypertension, whether it's any kind of disability, whether it's mental illnesses like depression, anxiety. Just acknowledging the problem is not enough. You should intervene, whether it's through psychological counseling, whether it's through medication, whether it's through going to your geriatrician doctor, but do make sure that you intervene, because if you don't address those problems, it indirectly will affect your brain. Then manage medications. Now, you will be in a great space in life if you have no medications to eat whatsoever, which means you will not have any diseases. A lot of older adults have that, a lot of older adults don't have. What is important is to understand which medications are necessary and which are not, and do not reduce or increase doses of medications on yourself. I think that is one of the very important things. Please contact your doctor before starting any new medication. Do not take over the counter medications, even if anything is available through the pharmacy, unless you're not sure about. Then minimize stress. So stress is something which was always, I think, there. If you could say, whether it's this generation, whether it's past generation, stress is something which was there. But what matters is stress is the way we react to it. How do we handle stress? Now, whether it's physical stress, whether it's mental stress. So, I mean, if you're getting older and you are 80 years old, I'm sure at place of work, at home, at private, whether it's financial, whether it's work related, lot of stress would have been there. But it's key to important that you handle it with positivity rather than negativity, because there is no way to go around stress. Stress is there, but the way you react to stress is how you actually age as far as the mind is concerned. Then sleep. I think sleeping is very important. Quality of sleep is very, very important. There are a lot of times where we are worried about certain things, where we have certain worried about certain factors, whether it's family, whether it's friends, whether it's about colleagues, and we do not actually get sleep. So I think that is something which is very important, that you sleep well. So a lot of times I tell older adults, if you're able to take a small dose of a pill and you sleep well, it is better than not sleeping at all. Because not sleeping at all accumulates for a long time, and then that can lead to increase in your risk of cognitive issues, which is not good. Then sleeping, you might think, is a very, very simple process. It's not. When you sleep, a lot of factors are there. Like if somebody tells me I'm not getting sleep, there could be plenty of reasons for not getting sleep, whether it's because you live in a very loud area, whether it's because there is construction going on in buildings around you, whether it's because you are maybe close to a highway or a railway, or whether it is because lighting is not, I mean, you're not, there's a comfortable lighting, whether your bed is not ideal for you, whether you have back issues, whether you have problems of urination, whether do you have to get up every time and pass urine. So, I mean, there are so many things which are, so it's very easier said and done, that sleeping well. But if you have a problem with sleep, the easier way is to take the pill. But the important part is to know why you're not sleeping. A lot of people have snoring, something which is known as obstructive sleep apnea. So, which is something which is reversible. So, if you put a mask, which is known as the CPAP machine, wherein this can be improved, the oxygenation usually reduces in obstructive sleep apnea, the sleep disorder, which we call. And if you put the mask, all the excess of carbon dioxide is thrown out and you're able to sleep well. So a lot of people now have understood that sleeping is very, very important. Now, if you remember as a child, you must have heard it, or you must have told to your children, maybe your grandchildren also, that before exams you should sleep early. It's not it's not because we should sleep early so that we are fresh for the exams, but we should sleep early because whatever we read, the memories crystallize. The memory actually crystallizes well if we sleep well. That's why sleeping is very important. So, if I have to sum up the entire talk in one slide, I think this is the one. It is known as, I think, the ABC of actually brain health. So, one is awareness. You have to be aware about things. You have to be connected with society. You have to be connected with the social network. You should be aware of your brain. You should be aware of your body. You should be aware of your health. So awareness is matters a lot for brain health. Please monitor your blood pressure. If at all your blood pressure is high, then it should be treated. Community engagement is very, very important. Community engagement is really activates your brain. Yes, it's very important that you have positive community engagement rather than people who don't like. Then drugs and smoking is a strict no-no. By drugs, I mean your medications which have side effects. Environment matters a lot, both your internal environment and the external environment in which you are living. Food and diet matters a lot. The type of food, the quantity of food. Glycemic control is directly proportional to how controlled your sugars are. So diabetes is not good for brain health. Keep a check on your sugars. Hyperlipidemia, cholesterol is not good for your sugar, it's not good for your heart as well. It's not good for your brain. Inactivity. During the pandemic, it was discovered that if you're inactive, it is as equal as smoking cigarettes. So, sedentary life is not good. You should keep moving even if you are at home. Do not always sit in one place. We should never become couch potatoes. We should basically be people who are moving around, even if you're not moving down, going down. You should move around at home. A lot of times during the rainy season, we tend to not go out and walk. In that time, do not stop walking. Please keep moving in your home. Fine, you might take 20 rounds of your locality, which you can't. If you move 40 times in your home, it might be as equal as doing the same. Then insomnia, sleep. As I said, sleeping less is never good. So these are all maybe the cornerstones of brain health. It's very important to preserve your brain. Why? Because the feeling of even forgetting things is quite scary. And you do not want to obviously land into the dreaded Alzheimer's part of disease category. However, I would say not all forgetfulness is Alzheimer's. So always keep yourself, get your memory checking. Your cognitive screening should always be done. Memory tests are very easily available. So you should do it to just make sure that you actually are hale and hearty. So thank you. Thanks a lot for your patient hearing.
Thanks a lot, Dr. Prem, for that inspiring talk. Now the floor is open for question answer. You can unmute yourself and ask any question.
Sir, myself, R.K. Modi. We are very fortunate to join this MRL. This is a concept of Dr. A.K. Sengupta. We are very thankful to him because, as you said, to keep your brain stimulated, so many things you have to do: dancing, singing, writing, then doing new things, etc. And this platform has given us everything. Singing. As I was not a singer, but after joining this, I am singing. Maybe good or bad, I don't know. Or physical activity, physical connection, that is also being done by the MRL. Picnics, physical entertaining programs. Just we are going have one of them at 5th October. So I must say this for this brain stimulation, MRL is fortunate to join this, and thanks to Sen Gupta ji, who has conceptualized and did it. Thank you, sir.
No, I totally agree with you, sir. Ultimately, you need a platform, and I think the platform that has been created here obviously makes sure that you are stimulated in various ways, which is very good for the brain.
Sir, I have a question.
Yes, sir.
Though we are doing meditation exercise, I'm not getting complete sleep. I would say 3 hours, 2 hours, 30 minutes, then I get up, again go back to sleep. If it is intermittent like that during the night and early 3 to 5, I'm awake. Again, when I'm tired, so again go and sleep. And I'm comfortable. Is it a normal pattern after 70? Is it acceptable? Because
So
There
not
is not.
everybody has it, but if you are
Yeah.
able to get back to sleep
Yes.
almost immediately
But
when you
it's
are obviously not
not
getting sleep, then it is okay. But
Okay.
if you get up once and you are not able to sleep the entire night, then that would not be healthy.
Okay. That's good. Because of the meditative, sometimes we are listening to the soft music and close your eyes and you get up for a few minutes for the washroom and then again drink some water, again sleep, like that means. And
Yes.
second thing was sometimes the memory recall, like afternoon, if we are tired most of the time when you go out and all perspiring, I realize that it is better to take rest, do it pace walking, not immediately at one stroke, 100 steps, okay, 20, then 30. I mean, balance the as per the outside environment and the traffic, because we have to inform someone known to us that I am here, or my known people, and even my watchman knows that he has gone that place. If I am tired, come back, like that. So this routine is good, and communication mostly we are doing on the media. But I feel if they call, give a call, that is a very big relief to anyone. I realize that I call to different countries, but I call my near and dear. How are you? Okay, I have a surprise for you. Please see this program. So this itself is a self happiness. Like I am telling 10 people, though they know it, but the soft reminder sometimes triggers them to do that thing, and which I feel very happy about my retired life, Dr. Sen Gupta, and each one of you. And thanks, doctor, for giving us such a lovely awareness. Excellent. And we look forward to meet you in person. Thank you.
Thank you. Thanks.
One question. I just want to check on you. If somebody is suffering from RA, all these things which are being suggested of, they are at a very limited level. How does the person handle? And at the same time, when you spoke about the medication, you happen to be saying that you have to be strictly no if the side effects are very high. So how do we handle in RA medication as well as how to deal with the kind of things that you were suggesting for a patient who is suffering from RA?
Again, sir, directly to be very frank, RA and brain health might not always be related, but yeah, RA medications there are huge number of medications for RA, especially related to pain and inflammation. So it all depends on what you can say what stage of RA that older adult is in. A lot of times RA could be actually very docile, wherein you're just taking medications for maintenance and there has not been any flare-ups. And a lot of times people have frequent flare-ups, so that becomes a bit difficult. And one of the very important things with RA is, at least what I have seen with patients, is follow-up matters a lot. So at least if things are okay, usually follow-up between 3 to 6 months is okay. But things are not okay, maybe frequent follow-ups of even 3 months to see how you're doing is important. The problem with RA is quality of life gets affected. Uh, and it all depends on which joints are involved. Usually very small joints of the hand are involved. So the quality of life to a great extent can get affected. So I think what medications of RA, and depending upon what all other medications, whether you are having other comorbidities, that matters a lot. And instructions of those medications, how to take, when to take, if you are not sure about it, you should doubly check, because in RA, I have had patients who have had issues where people have taken medicines which are to be taken weekly, but they ended up taking it daily and sort of landed in a lot of problems. So I think that's what would be the best answer. Yeah.
Thank you.
Yeah.
yeah. Can I speak now? Hello. Can I speak now?
Please go ahead. Please go ahead.
Yeah, I'm Dr. Bhagwant Prajapati, recently joined MRL. It's a very great opportunity for us, and through R.K. Modi ji. So this type of seminar is very rare. Really, through this life, I have never seen. It's a very much beneficial for us. So one question is with my friend. He's very hale and hearty. When he does some gym exercises, he frequently goes for urination. So he's Helen Arty. He wants to continue the gym exercises, treadmills, and all this, but frequently he has to go for urination. So that disturbs him. So these are the things. He's of 69, 70s. So in such situation, uh, I need your delighted answers and all these things. Kindly throw some light.
No, sir, it all depends on what is the cause of increased urination. There could be a plethora of causes, in spite
Yeah.
of him being hale and hearty. Uh, for example, as you get older, the prostate tends to get, obviously, the
Yeah,
size of the prostate tends to increase. So it's a very, I mean, if it is that, then it's a very simple thing wherein he might need some medications, or if he's not having significant symptoms and which is not bothering his quality of life, and we do an ultrasound and his prostate is normal in size, then you don't need to do much. So I would still say that a basic testing of the urine and maybe an ultrasound would help. Of course, apart from that, without looking at him or discussing in detail, it will be difficult for me to comment, but this is definitely a minimum which can be done.
so he should not continue this gym training on treadmill exercises till he gets proper verification and tests and all these things.
No, I would say at least get those tests and then we can obviously decide whether he can do it, because they might not be directly related or they could be related depending on what medications he's on.
So very nice, sir. Just I wish to add that what I am doing, because after retirement, I have joined charity programs, Lions Club. I am busy with all these things and connected the people. So and I am like R.K. Modi ji. I never started singing in my life. I was a corporate manager in ONGC, so I never thought of the singing. Now I started singing. It has become a passion for me. Now it is very much a liking field for me. So connecting the people, touching the thoughts and all these things. So I'm one or other way I'm connected with the people. So this is my way. From thank you very much, sir. Can I
Thank
take
you.
your
Thank you.
numbers and connect sir? Take your contact number so that
We
I
will
can.
Yeah,
we
sure,
will
sir.
give you the number.
So
Yes,
Dr.
I'll give you the
Sengupta will
number.
share it.
yes, sir. Because I
Hello.
if you want to 30 people, I want to do this in our society also. Yeah.
Hello.
Sure,
I'm
sir.
Prem.
Sure.
Yes,
So
sir. Yes. Thank you, sir. Thank you, sir.
things that
Thank you.
what happens sometimes people get addicted to the idiot box called TV. It's called rightly so because our brain stops thinking. So in place of this getting addicted to TV, one can have a limited
नहीं,
time to that and
मैं कहा, चालू
divert
करेंगे कि बाद में बस हो रहा
some of the extra time into
है
reading.
सेमिनार
Reading involves the use of mind, so it's a good
अरे
brain exercise.
ये हम ना
And for me personally, I feel the writing is also very good mental exercise. What I might not be thinking or using my brain so much, but during writing in discussions or issues or things, that helps about the size of the brain. So that is one good thing that one can think of. And then uh, apart from this regular exercise, physical exercise, so that increases the flow of blood to brain also, that is good. And then this meditation, as you have said, this is very necessary. But there are so many techniques, but it is necessary. And importance of sleep is because we get prepared during the sound sleep. There are so many stages of the sleep. So have a continuous long deep sleep, and you may cover your eyes or whatever so that you don't get disturbed. These are some of my exercises.
Yeah, ultimately, you should always give yourself memory aids, which I feel. So, for example, writing down things is much better than just noting it down maybe in your phone. Reminder should always be secondary. They should be reminding you over top of writing. So, if you have a to-do list, always try to write it because there is more stimulation of the brain rather than just depending on the technology, which most, to be very frank, most people of our generation at least are dependent on. Whereas maybe if it was the older generation like you or maybe even older, where people used to remember numbers and make those phone books. I mean, they knew that on page number 3 the 10th number is this particular person with saying that this is the number. So yes, I would say, but the best part about the brain is retraining, so you can always retrain. Yes, when you get older, maybe it might take a bit more time, but uh, always be excited to do new things. When you do new things, then the brain will not get bored. If you do repeatable things, sometimes the brain does get bored. The brain needs a challenge. Like Sudoku, for example, Sudoku and even puzzles are something which are recommended. But not everybody likes doing puzzles and Sudoku. So we should challenge your brain, but not necessarily in a negative connotation where you don't like doing it. Try to pick something which is you like to do. So I mean, it could be crafts, it could be a skill which you actually like, and that would motivate you to even do more. In fact, you might actually profess it and tell others also to do. So ultimately, what happens is you can become that beacon of inspiration for everybody else. So I think that's why I think ultimately you should use this opportunity to even inculcate into others so that they can also do, and ultimately everybody benefits.
Yeah, I like
I
to
may
clarify small aspect that I was saying about writing. I meant to say participating in discussions and thinking in various kinds of can be social causes, national causes, international or humanitarian causes. No, they're discussing and trying to understand things. So while we are writing in the parts and participating in discussion, there is a meta thinking. I find that comes much ahead of what I otherwise be using my brain in. And sometimes all people also have this habit of always thinking. So that is also one could say kind of disease. Should not be thinking always. Just keep it blank. And you have to do a thing.
Can
Hello.
we give? Can we go
Yeah.
for the next question, please? Please.
Okay.
Yeah, I am again R.K. Modi speaking. Sir, someone says the playing games on computer or mobile will also stimulate our brain. Is it true or false, sir?
No, it is. I mean, I would say there are specific games. For example, there are cognitive games which are there, which actually can be quite stimulating for the brain. But that's why I said there are two very important things which matter when you're doing anything on a screen. You have to look at your screen time purely because it's not good. So when you do it in the day is important. Secondly, your vision has to be good. And thirdly, you should have good sensory functions. So especially touch. A lot of older adults might not have the touch as you get older if you have diabetes or if you have certain things. But if you're aging normally, then it will not be a challenge. No, it's so it is good. Again, the amount you do matters, what you do matters. Just looking at the
Correct.
screen and looking at videos is not going to be helpful. But at the same time, if you do some games which are brain stimulating, then that is definitely good.
Thank you, sir.
We'll take one more question if anybody has got a question. Last question.
One small thing. What are the exercises for brain? Because I feel that just any machine gets frustrated
Sir,
when not
I
being
have a question.
it's
I
the
have a
game.
question. I
Yeah.
have a question,
Yeah,
Doctor.
Padmakini madam, please go ahead. Please go
Yeah,
ahead.
actually, can you tell us something about mindfulness? I heard that sitting quietly for some time will also help our brain. Only thinking about positive things.
Yeah, I think one of the very important things which is there in general, which is a concept which is actually, to be very frank, it was always done. Maybe it's been talked about and it has been given a term, mindfulness. So what is actually mindfulness? Mindfulness is a very simple thing. It is just acknowledging things which are around you which you maybe never acknowledge. It is your own thoughts, your own feelings, your own surroundings, your own environment, which can be done as good as just maybe closing your eyes, even realizing breaths, your own breaths. A lot of times we know we are breathing, but have we slowed down our breathing and realized that how many times we actually breathe? So mindfulness is very, very good. It's very, very important. And it is something which should be practiced even more. The reason is it helps in avoiding destructive habits and responses which are actually negative. So I think it's a point taken, and mindfulness is something which a lot of people are practicing.
Yes.
And there is a big distinct role of yoga and meditation as well. I think you can do that. It's very important that to have a good brain health, you have a calm mind. So to keep your mind calm is very, very crucial in how you actually sort of go ahead with, in general, with life. And I feel as you get older, with experience, you have that advantage of experience.
Yes.
You handle stress better. And with the concept of, one is mindfulness, and I think another concept is reminiscence. We should always be thankful about what we actually have. So I always tell people to make a
Yes.
list of what you have rather than keep thinking that what I
Yes,
don't
yes.
have or what I have not achieved. Because
Yes.
everybody around you. So for example, we keep saying that we it's like when you're in a, I mean, this is of course very things which are very materialistic. So if you're in a two-wheeler, you think you need a four-wheeler. But what about the person who doesn't have legs? So I mean, it's about looking at the positive part
Good
of
things.
life. You can see a glass which is half empty or half full. But if you see the half full part, then is when you actually age successfully. So being positive is one of the very important ways of going at. So I think, yeah, mindfulness is good, reminiscence is good. So I think these two are very positive for aging well.
Thank you
In
so much.
mindfulness, they say there are
Okay.
little aspects also,
So
like
I think,
be involved in what
so
you
I
are doing.
think,
Not that
I think with that, we bring an end to this particular program. I think, Dr. Prem, we had an exciting session. We had a
Thank you, sir.
very thought-provoking and exciting session. And look forward to your support in future also. Thank you very much for
Thank
being
you,
with
sir.
us and spending time.
Thank you. Thank you. Thank you for having me.
Thank you.
Thank you.
Thank you, sir.
Thank you. Thank you.
Thank you.
Thank you. Thank you.
Thank you. Thank you so much.
Thank you.